Good morning, Slow. Nice to see everybody. As Jim said, I'm Patrick Castor. I have 90 minutes. Is that what yeah, okay. As Jim also said, I'm relatively new to Dignity Health French Hospital. I came in the fall, but I'm not new to Dignity Health. I was with one of Dignity's hospitals in Los Angeles. I joined Dignity about 6 years ago. And when they were recruiting me to come to San Luis Obispo, they said the weather is perfect and it never rains here. So I bought it. But actually, I've known about this area. I've been coming to this area for since the late 80s. Have family and friends here. And while it's grown a lot, it's just remains a wonderful community, and I couldn't be happier to be here. And I did want to talk a little bit about the hospital, and there was some questions I was taking before we started here about the pandemic. So I'm going to divert a little bit and just tell you a little bit about kind of what's going on. While the pandemic and the effects of the virus on hospitals has very much abated, and the pandemic is not quite over, the effect on hospitals from a patient standpoint is very low right now. In fact, today we don't have any COVID patients in our hospital, thankfully. So I will definitely applaud that. However, the hangover effects from the pandemic are greatly affecting hospitals and healthcare in general. And it really has to do with staffing and a major exodus of staff, mainly nurses, as a result of the pandemic. So we had a lot of nurses that were there for a long period of time, and they may have been thinking about retirement. This is prior to the pandemic. And they said, I'll just do another year. I don't really want to retire. That doesn't sound like fun. I love what I'm doing. I love the people I work with. I'll do another year. I'll do another year. And we saw a lot of that. Pandemic came along and they said, oh, we're out of here. We're done. And so there was just this mass exodus. So California is 40,000 nurses shy of what we need to have. And to just give you some perspective, there's 400 hospitals roughly in California. Among the 58 counties, there's 400 hospitals. So that's about 100 nurses short per hospital, and ours is no exception. And so you see there's staffing shortages everywhere, right? There's staffing shortages in retail, there's staffing shortages for restaurants. And so you see restaurants, some will close on Mondays or close on Tuesdays or close for lunch because they don't have staff. But as a hospital, if you don't have staff, you don't have nurses, you can't close, right? What do? You don't have staff to take care of patients. We can't close on Mondays. We can't close for lunch. And so what do? Well, what you do is you pay a lot of money for what we call contract workers. And so these are, you may have heard the term traveling nurses or registry nurses. And these are nurses that will go and maybe take a 12-week assignment at different places and then move to another place. So this time last year, you'll remember this time last year, there was a huge spike in January and into February, a huge spike in COVID. And there was a huge shortage of staff, and we were paying $205 an hour for RNs, which is an annualized rate of $425,000 a year. And so you can tell that that's why all of the health systems really across the country are reporting record losses because of the tremendous shortage. And so our focus is really on hiring direct staff that are part of our family, that are direct employees of the hospital, because those traveling folks we get through agencies. And that rate, by the way, the $205 rate has come all the way down to where it is currently, which is $137 an hour that we're paying for 100 traveling nurses. So you can do the math on that. It's very unsustainable. But again, we just don't have the luxury of closing our emergency department for this great community. And so that's what we do. And so our initiatives are really, a lot of them are aimed at how do we get, say, new nursing graduates interested? How do we get folks interested in nursing as a vocation from high school? How do we really, we're looking at all different ways of attracting folks and helping them move into this community. As you know, this is a very nice community, but what we hear a lot from our nurses is that it's an expensive place to live. And so we're working on addressing those issues as well and helping them with housing. And so there's just there's just a lot of elements that are affecting us as a system. But specifically, some of our other growth initiatives are that we are planning to build a brand new state-of-the-art patient tower at French Hospital, which we're very excited about. That will have a lot of services. We'll be able to offer some new services as well. And we have several other building projects, a new cardiac catheterization lab that's getting to be finished. We're building a brand new, beautiful chapel. And a lot of these projects that we're doing, including our new tower, which is close to $200 million, has been funded significantly by members of the community. And it really is pretty amazing, which is very important in this climate, because as you can imagine, with all of the losses that many of the hospitals and health systems are bearing right now, it's hard to make capital investments. And so the capital projects are kind of piling up. A lot of them were put on hold due to the pandemic and the financial performance. And when you can kind of go with a project and pitch it and say, hey, you're only going to spend basically 70 cents on a dollar because the community is pitching in 30% of the cost of a project, or 20% even. It's very compelling to kind of get those capital projects to the front of the line and to get those approved and funded. And so we're very excited. There's not a lot of communities. So Dignity Health is part of Common Spirit Health. I should have mentioned that at the beginning. It's the largest nonprofit hospital company in the country, with 140 hospitals in 22 states. I know I'm getting the hook, but I feel like the Academy Awards are going to start playing the music. Okay, I'm glad the guitarist isn't here. But I would just say, among our 22 states that we do business and the 140 hospitals, I don't know of one that has the strong community support as we do right here in San Luis Obispo. So I'm honored to be with the hospital and representing the hospital, and really honored to be part of the community. So thank you for having me.